Dr. Wang is, as I mentioned this morning, he's a consultant in rheumatology at the Mayo Clinic in Florida, and he's going to talk to us about a very common and important topic in our practices, not just in rheumatology, but a lot of the specialties, including primary care, which is fibromyalgia. Dr. Wang?
Thank you very much. There's probably no other diagnosis that induces more sighs of frustration and rolling of eyes than fibromyalgia. But as a kind of a testimony to you, I have learned a little bit about how to present this matter to patients and how to guide them through their symptoms, work with them to resolve many of their symptoms and have good outcomes. So actually, when I was a resident, I would have never dreamt of saying this, but I kind of like fibromyalgia. So no disclosures. Of course, we know that this condition is complex and has multiple dimensions. Not just chronic widespread pain, but features like non-restorative sleep, fatigue, psychological dysfunction, and at least for many people, regions of localized tenderness, which might be helpful in the clinical assessment. And we also appreciate the fact that the last decade has brought a lot of science to the understanding of fibromyalgia, so that now we realize that it is actually very prominently a disorder of sensory processing by the nervous system in many, many of its components. Fibromyalgia has been known for a long, long time, but not very well understood. For example, take this story by Hans Christian Andersen that we all know. And the text for verbatim says, in the morning they asked her how she slept. "Oh, terribly bad," said the princess. "I hardly closed my eyes the whole night, and my whole body is black and blue this morning. It's terrible." Well, that is what I call high maintenance. But actually, it is a situation where she could perceive the placement of a pea under 20 mattresses. Maybe this is a sensitized nervous system with non-restorative sleep and chronic widespread pain. So in 1835, we have a pretty apt description of fibromyalgia. The American College of Rheumatology tabled in the early 1990s